My name's Angelina Dixon, and I'm a nephrologist at University of Colorado. And I work with young adult patients and patients who are transitioning from pediatric to adult kidney care. Of course, I'm passionate about medicine. That's one big part of becoming a doctor. But beyond that, I really love mentoring and being a source of support for my patients. And I think that the young adult patient population is just the perfect population to work with because they have, they have their whole lives ahead of them. They're, finding themselves and finding their careers. Some of them are starting families. And so it just is it's really fulfilling to get to work with them and to support them through this time period and, to do our best to keep their kidney disease at bay so they can just focus on their goals. They would need to come see me either because, they're transitioning from pediatric kidney care. So they have kidney disease or high blood pressure that has been diagnosed in childhood, or sometimes they have new diagnoses as young adults. And so both of those, patient populations I get to work with. I really like to get to know my patients. I like to get to know kind of where they're at in life, what their goals are. And then, of course, when approaching their kidney care, we use evidence-based medicine. I focus on both the pediatric and the adult medicine and evidence and kind of figuring out how to combine those and what's most applicable in a given patient without making them feel like they're taking a big jump from their pediatric care to their adult care. And then I focus a lot on kind of their symptoms and side effects of medication to make sure that, ultimately their quality of life is what we're prioritizing. I just value getting to be a part of their story. I think it's so rewarding to hear about kind of where they're going and what they're doing. And, I have patients that are in law school or in med school or artists. And it's such an honor to get to be a part of their story and to hear all the things that they're doing and just to, be another source of support along the way.